Welcome, Color of Success podcast family. I'm your host, Dr. Stephanie J. Wong. Check out my memoir, Cancel the Filter, Realities of a Psychologist, Podcaster, and Working Mother of Color, where I share my experiences in the realm of mental health, both professionally and personally. Color of Success podcast is streaming on all your favorite platforms and socials. Whether you're on the go or comfy on the sofa, you can tune in at your own comfort. As you know, we love growing discussions with our guests from our AAPI and ethnic minority communities. With so many friends and experts from different aspects of life, we love learning their stories and understanding what their success means to them. Let's get into it. Theodoric Chu is the co-founder and CEO of Intellect, Asia Pacific's leading integrated mental health care service provider. Today, Intellect offers global end-to-end mental health care support, ranging from virtual and AI-enabled care to in-person care, addressing subclinical and higher acuity needs. Stemming from Theodoric's personal lived experience going through therapy from a young age, Intellect now serves over 3.5 million members with 7 offices globally. The company is backed by world-leading investors, and Theodoric was named on the Forbes 30 Under 30 list in 2022. Theodoric, thank you so much for joining me so far away and working out this time difference.
Appreciate you having me here. It's a joy to join in this podcast here.
So your company, Intellect, provides mental health services across different Asian countries. And when I came across your LinkedIn and this article that I read, I was like, wow, this is very consistent with what I try to do in the States. So tell us a little bit more about Intellect and how you're able to tailor some of this treatment to various communities.
Sure, definitely. So I can give you maybe just a brief overview and intro to Intellect and who we are, what is we do, just for your listeners tuning in as well. So Intellect is a healthcare company focusing particularly on mental health and well-being. We started the company back in the end of 2019, right before the pandemic. I'll touch on the why and origins in a bit, but the goal quite simply was to build a new form of mental health care that is relevant towards this day and age, accessible, and actually really very much more just an accessible in the literal means of access to in your fingertips, but really access in terms of relevance towards each of us as well, right? I think it's not unknown that mental health has a stigma globally, but particularly in Asia, broader Asia Pacific as well, there is a lot of stigma around it, deeper than I'll say Western cultures, right? We have quite deep-rooted beliefs traditionally around keeping it in, being strong, and not letting out as easily, and that leads to a lot of different issues. So we started the company to really change how mental health care is done, and using a tech-enabled means. And today itself, Intellect, over the last 4+ years, we've grown and scaled to become the region's leading mental health care service provider. We often provide end-to-end care from very preventative self-guided programs, CBT-based and other modalities, all the way to teleconsults, crisis helpline support, all the way down to clinics, which we now also own and operate ourselves across the region as well. So really trying to offer an integrated mental health care system that really is needed to bridge different points of care, no matter where anyone is on their mental health journeys.
So you're talking really about a spectrum. And so how do you see these services rolled out in various countries? Because I imagine there's also governments to work with, different providers and how they're trained. So could you tell us a little bit about the logistics of what Intellect has to kind of work through in order to provide these amazing services?
Definitely. So I'll say we start off pretty ambitious in the sense that, not all at day one we tried to boil the ocean, but we wanted to build something that was from Asia for the Asian population, right? I think we saw a lot of great stuff, usually out from the States, in the US, in the West, and those are great solutions, but oftentimes lack the cultural nuances when it comes to its Asia, be it as benefits deployed by employers or whatnot. So we want to build something that's really from the region that understands the different countries' local nuances, and that's what we set out to do basically. And to your point, so we're headquartered in Singapore, but today our coverage expands and extends over the Asia Pacific region and even beyond actually. But our roots really focuses on Asia when we began. And today itself, we do have offices across different regions. We offer our mental health care services in over 30 languages. We have clinicians across our network in over 60 plus countries. So the goal is to create parity of care, no matter whether you're in Korea, you're in Hong Kong, you're in Malaysia or Singapore. You can speak whatever language you prefer, but there should be a level of care that suits your needs, and that's what we've built, today itself. So logistically, naturally, it is quite a big effort, and to say the least, right? From building up the infrastructure, which is very nascent as a whole as an industry in Asia when we begin, all the way down towards the regulatory differences, nuances by market as well. All right, so to give just a bit of flavor, for better or for worse, mental health care isn't as regulated in Asia as I think it is in the US by states, or in Australia as well, with the exception being in the Pacific region. That's it. Every country has its own bodies of associations, regulatory bodies that actually accredits and recognizes qualified mental health clinicians, from counselors to clinical psychologists. So that's where we actually hold a very strong standard. Strictly only bring on qualified professionals recognized by these local bodies, while having our own governance in place led by our clinical team as well. And I'll say that the real hurdle, after that initial piece of making sure we've got our core governance in place, is how we build the infrastructure and network across different markets. Every country is really quite diverse, quite different, between Vietnam to Thailand, in between as well. So that's really the big, I'll say, mode or effort we've really invested our last few years building that network altogether.
And like I mentioned, I've traveled some and been to Korea 4 times, Japan, Vietnam. And so, obviously there are different socioeconomic GDPs and all those kinds of things. So how does it tend to work for people paying for the services and increasing access to maybe some folks that may not have as many basic necessities taken care of?
Yeah, it's a very good point, right? I think fundamentally, no matter where you're from and what state of the economy of the country that you're living in, the struggles we face are all very real. They may come in different forms, but we do face them, right? That's it. They are different in how we experience them. Some folks living in Korea, in Tokyo, in Singapore, Hong Kong would face quite different stresses from someone living in more rural, farming villages in Vietnam or Thailand, for example. But they still face the same similar emotions and struggles when they do experience them. So getting access, regardless of where one comes from, it's a key thing. It's not a simple thing, but it's an important thing that we strive to do. So when we look at how can we get access to care, and that's where the more, I guess, strategic element of go-to-market comes in. In the realm of healthcare, there are, I guess most listening would be somewhat familiar. Beyond just the individual consumer payer, there are different payers in the ecosystem that really moves the needle for healthcare access. In the US, it is a bit different from how it is run in Asia in terms of the self-insured, and fully insured models by employers, varying by countries altogether. How it is like in Japan is vastly different from how it is like in Singapore, for example. So that's where we actually navigate and move. But what's always core to it is who are the key payers. They are your employers, they're your health plans and insurers, they're your governments, and then the schools, and even out of pocket as well. So for us is, how do we actually aim to find the most relevant and suitable payers in each of these markets that we have the, I'll say, ability to actually collaborate with or even move with, starting from a very initial wedge and then moving further and further. So we've made very strong headway now. We've seen the broader landscape of health plans and insurers really being very apprehensive back in the early days of the pandemic or pre-pandemic. And then now today where they're at, they've really moved quite in good leaps and bounds to really ensure and cover mental health in much more meaningful ways today.
What do you think that we need to do to expand services? Obviously, you have so many strategic plans and implementation, and how others can help, because there are a lot of immigrant populations in the US, and so many people are hoping to not only help within the US, but to various countries that their parents came from or their grandparents came from, because those values are transmitted to their children, to us. And so what can we do to really help this destigmatization efforts, across the globe?
Yeah, that's a great question, right? So it really boils down to also to what we think a lot about it, and as to what is the why of what we do, and the how we do it as well, right? So to give just a bit of background, why I started Intellect, why a mental health company, besides many other things that one could do, it's through a lot of personal lived experience as well. I actually started seeing a therapist when I was 16, struggled with quite chronic anxiety, panic attacks growing up. And I'll say I was quite fortunate because my folks didn't fully understand it, but they were open enough to say, okay, sure, you want to seek help, that's fine, we'll support you on that. So I count myself quite fortunate for that. And the first session that I went with my psychologist, and I remember it was very cathartic. The very clear message that sticks strong and very clear to me today, until today, it's the fact that if people knew what therapy actually was and is, and how misunderstood it actually is, everyone would be actually doing it. All right, people have this misconceived notion that you have to be very, very ill, very acute in care needs to want to seek help, at least in some parts of Asia. But as we know quite well for this group here, this audience here, it's not actually the case. We can see from very, very mild needs all the way to more chronic, more acute needs as well. So that's the baseline as to why we started to do what we do at Intellect. And when we think about how can each of us actually play a part in this, at Intellect, we try to do two key but very, very simple but very key things, right? One is to educate, and second is to increase access. So we've done a lot of the access built with the infrastructure of the tech platforms, the clinical network, and the reach of how we built with payers in the markets we serve. But one of the other key things that we always do on an ongoing basis is the education aspect, right? To make sure that people understand what the needs are, what it is, firstly, what the needs are, and how to actually support those who need it, or just at least be open to it as a whole. One of the big things linked to this, however, is that we do see that some people have this, I'll say there's almost a trap even where there's a lot of attention going on with mental health the last few years, a lot of media coverage, which is a great thing. But people may misconstrue that the job is done, right? I think the way I see it is that awareness is made, the action taking now has to begin and go further than where it actually comes from. So I think that's a key thing we try to drive across in the markets that we serve. Awareness is now being established, right? It's still an ongoing mission, but that's a good foundation. But the action taking begins. The job doesn't end from there. So in each of our own personal capacities is how can we actually spread the message, be a lot more open, accepting, and supportive of people who have these needs and not judgmental as a whole.
Yeah, and here there is a huge need for providers, and particularly those that are people of color. And so how are various countries or the regions that you work in really encouraging people to see this as a viable career?
There are people that genuinely care about this journey. So from where we see across the network we have on board at Intellect, you have folks that, off the bat, out of school, went straight into psychology, counseling, and became professionals practicing this, this form of care post-school, right? And then there are folks that are, in the middle of a career, they were managers, they're coaching people, and then they switch and pivot into become counselors themselves. So we do actually see a lot of this aspect where people, through their own personal experiences, through being caregivers as a whole, really draw towards this goal of supporting people. So there is that, I'll say, aspect where in Asia, I definitely do see a growing pool of people that move into this trade, caring about this whole mission more than just the physical aspect. That said, it is a very, very critical thing. We do see more and more efforts from the governments. To give you an example, we see a lot of action being made in different governments across Asia, but just to cite one country, so Singapore, where we're in, the Ministry of Health actually launched a national mental health strategy at the end of last year, which is actually a big move for I would say the broader region here. And as of earlier this year, the now Prime Minister, the president equivalent, actually announced that mental health is a key priority in the national agenda. So they are making actually huge steps to invest in the education, the training, the supply of clinicians, the availability of clinicians, and even the way that care can be actually accessed and paid for as well. So I'll say there are multiple efforts in place. The governments definitely play a big role. And I'll say the US with the Mental Health Parity Act for the insurers is a big thing that isn't as commonly found in other countries, but I think progress is being made.
Absolutely. And the other big part is how are families integrated into mental health care? Because that's a huge thing, especially since I think you said this really well of like, you don't have to be on the spectrum of high acuity or chronically mentally ill. It can be family stressors and stress over work and things of that nature. But how do you see families, or if they are involved in people's mental health care?
Yeah, it's quite interesting, and this is just a personal observation, and I may be wrong in some context, but I think having seen folks from both the East and the West, at least in Asian communities, it is quite clear that there are closer family bonds, I guess in general, at least, physically based, not oftentimes with parents, at least in Asia, in India, in Singapore and Hong Kong, where families stay very close to each other or even together, even after they grow up, have families and the like there. So that could be both a good and bad things at times, right? Because seen in the pandemic, spending too much time with each other, maybe too much for some as well. So I'll say a couple of things, right? And if I could draw on, the mental first aid training, mental first aid kind of approach that's out there, there's a few aspects that we can practice in day to day before seeing someone that's in acuity, but being an open listening ear, not being judgmental, offering support of signposting help if you are aware of any, right? Not trying to be a clinician yourself, but being able to signpost, being able to listen, oftentimes is a very good start, right? And actually encouraging people who may appear to need some help, seek help. I think that's a key thing. But I'll say for me personally, what I've observed in close personal circles, in close personal experiences, it's really being open, being willing to listen without judgment, allows someone to actually begin that journey of uncovering, and actually acknowledging it even as well, right? Some folks are just very, very new to the whole mental health journey. So acknowledging the issue at all is actually a big hurdle. So I think getting them over that hurdle first before going to the next steps there, as a family nucleus, is actually really important.
Absolutely. And you're at this point in your career where you're building something new. And I mean, just to understand your story a little bit more, I mean, what are things that you continue to do to take care of your mental health? And, it is stressful being a co-founder and a CEO. And if you've had, these symptoms of anxiety since you're a teenager, it doesn't magically go away.
Yeah, definitely. So I'll say it is a good question. One I get asked, at times as well. How do I personally manage? Being a founder, working in a startup is quite a high, fast pace. It is a stressful job. There are highs and definitely a lot of lows as well. So I think a big part for me personally, and to be clear, I think each of us have our own approach to this. I personally do have quite clear boundaries I draw for my work and my own personal time to recharge as well, right? Yeah. So yeah, I mean, a big part for me is actually really having my own personal time, right? Having drawing boundaries. Of course, if something is breaking, something's on fire, figuratively, I'm there. But having blocked out time where you can have your own personal time with loved ones, your own hobbies, your own life is really, really critical. I'll say that's the first thing. Naturally, I do, go to therapy, ongoing, have a coach as well to help me actually regulate and work on myself. And as a whole, I'll say at least in the last recent months and years more so, incorporating more of a physical, healthy lifestyle is really important. I think founders often in their earlier years neglect the physical aspect as well, and that naturally has a very, very strong tie towards your mental health and well-being as well. So I'll say these different factors, drawing personal boundaries, having support, be it a social circle, or professional help if you need to, and then having a healthy overall physical life as well. Key things that I practice.
Absolutely. So, a big thing over here is cultural competency, cultural humility. What are some tips or thoughts that you have to let providers know on how to do that kind of stuff? And I say kind of stuff because DEIB over here is huge. What does that actually mean,
That's a great question. So I'll say a big thing that we aim to do, and I probably can share more from how, broadly we look at it at Intellect here. So when we look at what we're trying to do across Asia, a big aspect of, getting the rights to be really localized to the different countries and cultural nuances. And this can come in different forms, right? This can come firstly in fundamentally language, having the same local tongue. Even if you speak English, that breaks a barrier towards opening up. We see oftentimes. So that's the first big aspect. Second thing is really understanding where the other person's coming from, right? Quite literally, as we shared a bit earlier before, someone in Singapore or Hong Kong in a city-like environment, different needs, different struggles, different stresses from someone in more countryside areas as well. So those are things that we actually really aim to practice. How we deliver care when we work with employers and insurers. What are the mediums of reach we provide the care, all the way down towards the messaging, the comms. And actually even the programs that we develop as well, right? Having different scenarios, different examples in these sessions we develop, being relevant towards the audience that we serve as much as possible, right? So these are things that are really important, not missing out on different groups, that are out there basically.
Absolutely. So where can folks learn more about Intellect and really get involved in this exciting growth of yours?
Yeah, definitely. So, first and foremost, you can check out our website at intellect.co. Check us out on LinkedIn. We have a great marketing team that, puts out a lot of great content out there all the time. And for those that are just individuals out there, you can actually download the Intellect consumer app as well. It has access to some of the services that we offer. Just search Intellect on the App Store, Play Store, and you'll find us out there as well. So that's where you can find us.
Thank you so much for spending time with me today.
Thanks a lot, Stephanie.
Thank you for listening. We would love for you to subscribe to the podcast and join our community on all our socials at colorsuccesspodcast.com. Looking forward to you checking out my memoir, Cancel the Filter, Realities of a Psychologist, Podcaster, and Working Mother of Color on Amazon and wherever books are sold. I'd love to hear your Cancel the Filter moments.